Thank you, everyone, for joining HIV Prevention Today, PrEP, STIs, and Real World Care. We're going to start just by taking a quick look at our agenda. Okay, just to review our agenda quickly, we'll go over the vision, mission, core values, and purpose. Then we'll have our welcome, the introduction of our guest speaker, and Q&A, and then an event evaluation and closing remarks. The mission of NCBW 100 is to advocate on behalf of Black women and girls to promote leadership development and gender equity in the areas of health, education, and economic empowerment. Our vision is that Black women and girls will live in a world where socioeconomic inequity does not exist. Our core values, we believe in gender equity, inclusion, respect, racial and social justice, integrity and accountability, economic empowerment, and collaboration. The Health Committee purpose is to advocate on behalf of Black women and girls in the area of health. NCBW's health and wellness priorities are to raise awareness of health disparities and solutions, and to provide access to health care and wellness information that promotes behavior change, resulting in a healthier lifestyle for our young people and communities. Now we will have our welcome.
Good evening, everyone, and welcome. Thank you for joining tonight's webinar, HIV Prevention Today, PrEP, STI, and Real World Care. On behalf of the National Coalition of 100 Black Women, Columbia SC Chapter, Health Committee, we appreciate your time, commitment to learning more about prevention, education, and community health. Tonight, we are honored to hear from Mrs. Lizadra Cade, who will share valuable information about PrEP, STI prevention, and other strategies to support healthier communities. Thank you for being here. We look forward to an informative and engaging session.
Hello, everyone.
Good evening.
Evening.
Getting the screen up here. Hello, everyone. I'm Lizadra Cade. I just wanted to thank you, ladies, for inviting me again to speak. Anytime I get to speak about HIV or HIV prevention, which we're going to discuss today, I'm glad because not too many people know about this. So I'll go ahead and jump right into the topic. HIV prevention today. Specifically, we're going to talk about PrEP, which is pre-exposure prophylaxis for HIV. Not a lot of folks know that there is medication that you can take to prevent HIV. And we're going to also focus a little on sexually transmitted infections. So again, I'm Lizadra Cade. I'm a nurse practitioner, and I work for AIDS Upstate. AIDS Upstate, we have 2 locations in the upstate part of South Carolina. We have office in Greenville. We have an office in Anderson. I work at the one in Anderson. This is my contact information. If anyone would like to, send me a message, have questions afterwards, anything like that, here's my contact information. But at AIDS Upstate, we treat HIV, and we also focus on HIV prevention and post-exposure prophylaxis. Which is, after being exposed to HIV, treatment for that as well. Of course, all that entails sexually transmitted infection treatment. Also do primary care, and most recently, in the past couple of years, mental health care. So why prevention matters, why we even here. So we're talking about HIV, and HIV is still, an issue within our communities. Approximately 1.2 million folks have HIV in the US. About 13% of that population do not know that they have it and need testing. We're in the South. The highest rates of new diagnosis for HIV is in the South. We have about 49% of new HIV cases occur in the South, right? And HIV and PrEP use among the Black and Hispanic communities in the South. This is a diagram showing that. So African Americans, we make up about half of the new diagnosis for HIV, but we're only about 23% of the population that uses HIV PrEP. So HIV PrEP help prevent HIV. We're not utilizing those services enough. And it shows because we're half of the new diagnosis of HIV cases. Hispanic individuals as well, they make up about 26% of new diagnoses, and they're using about 19% of the HIV PrEP services. So that just kind of gives you a bird's eye view of why, we're even here talking about PrEP, because we need more awareness about it in the Black community. These are some more statistics regarding HIV, and it's focusing specifically on women. Black women account for about 18% of new HIV diagnoses, but when you look at the female population as one, Black females make up half of the new HIV diagnoses. That's next followed by white women and then Hispanic. So focusing in on South Carolina, we have about 19,000 individuals living with HIV in South Carolina. 837 were newly diagnosed in 2023. And this is a snapshot here in the bottom, looking at female categories specifically. And it's showing you that of the new and prevalent HIV cases that we have in South Carolina with women, most women are contracting HIV from heterosexual contact. So sex with a male individual. So Black women are at higher risk for HIV. Why? Because one, there's a higher community prevalence. So we just spoke about how much Black individuals make up half of the new HIV diagnosis case, okay, and cases. So we have a higher amount of HIV diagnosis within our community in general. Then not a lot of people know their partner status. We're not telling people, hey, you know your HIV status. That's not something a lot of folks talk about. I do see a lot of the younger folks are kind of talking more about that now, but that's not something that we are just used to asking, especially when you're dating someone. And then access to healthcare and stigma. The Black community has a long history of, not having the best access to quality healthcare. So that adds in, and then when you add health disparities, racism, biasness, that is another part that makes Black women at a higher risk for HIV. So I'm just going to review HIV real quick so that everyone's, aware. HIV, it stands for human immunodeficiency virus, which causes HIV. And this is a virus that attacks your immune system. Your immune system is responsible for helping you fight off infections, things that can make you sick, okay? When left untreated, HIV can advance to AIDS, which is acquired immunodeficiency syndrome, okay? When you're not on medication, HIV positive person, that is when they can transmit the virus to another person who does not have HIV. And the way HIV is transmitted is through semen and vaginal secretions, blood, can be through pregnancy and or breastfeeding. HIV is you're only going to get HIV if a HIV positive fluid like semen, vaginal secretion, all those what we just talked about comes in contact with mucous membrane. That could be a cut, it could be eyes, anything like that. That is where your risk is increased of contracting HIV. So PrEP, HIV pre-exposure prophylaxis. This is medication that you can take to prevent HIV. A person who does not have HIV takes this medication to prevent themselves from contracting HIV. All right. Again, I want to emphasize taken before you are exposed to HIV. If you're already HIV positive, or this is not something for you. This is also a medication that individuals who are participating in IV drug use, this is a way for them to also protect themselves against HIV. They could take medication as well, which is this HIV prophylaxis. It is 99% effective when taken as directed. So who is HIV PrEP for? Pretty much anyone who's sexually active, or anyone who participates IV drug use, where they're sharing needles and things like that. You're sexually active, this is for you. You're sexually active with women in particular. You're sexually active with a man who has sex with other men. You're sexually active with a man who might have more partners, or you yourself have multiple partners. If you participate in having anal and vaginal sex consistently, not using a condom, this is for you. And again, IV drug use. So your risk increases when you have more STDs. So the more STDs you have, the more at risk you are for contracting HIV, which makes this medication even more for your population. And a couple other things that we talked about: high community prevalence, partner viral status. So I have individuals who take PrEP who are dating HIV positive individuals who they're trying to not get HIV from them. So as a layer of protection with their partner being undetectable, in addition, they take HIV PrEP to protect themselves as well. So that's a whole nother discussion there. So we have the types of PrEP medication. I'm going to focus on the oral type, which is the oldest protection we have for HIV. These have been around the longest, and they are Truvada and Descovy. Okay, Truvada is the oldest, and this one has actually been tested in women. We have Descovy as well, but this one hasn't been tested in women. These medications you would take daily. Okay. And the biggest side effects, usually people may have stomach upset or some nausea, usually within the first week or two, but that typically goes away. These medications, in particular Truvada, because it is the oldest form of PrEP medication, and a lot of our older medications, we learn now how they could be toxic on certain major organs in our body. So in particular, the Truvada can be harder on your kidney system and your bone system. I always tell people that, but I've been doing this almost 5 years now. I have not seen someone actually have issues with their kidneys or bones from taking this medication. It may be a contraindication, like if you already have issues with your kidneys or your bones, you may want to avoid taking the oral medications. We have other medications that we're going to talk about next, but this is important. This is why it's important to see an HIV PrEP provider so you can pick the medication that works best for you. More about PrEP. So when this medication is taken daily for about 7 days with the men, after about 7 days, they have full protection, okay? So with this medication, you're building the medication up in your system. You're almost like you're building a defense wall. So when your body, if it potentially comes in contact with the HIV virus, you have that protection. For women, it takes longer. It takes about 21 days of a female taking Truvada or Descovy before they are at full protection. And this is just a look, the cellular level of what is going on when your body comes in contact with the HIV virus. So this first section here is just showing the outside of your body. This is your skin and your cells inside. So it shows like someone who does not have HIV, you come in contact with the virus, your immune system, specifically the T cells here, they pretty much fight off that germ. and hey, you don't even know what's going on. They're at, the fence working for you. When your body comes in contact with an HIV virus, they attack your T cells just like, a germ would. But what happens when you don't have medication or defense is HIV, in order for it to survive, it needs to multiply. Okay, so it uses the cell to multiply. And so once it uses the cell to multiply, that cell dies off, and then you have more HIV virus that's kind of dispersed in your immune system here. And the HIV virus is able to go on and continue to affect multiple T cells. And that's how the HIV virus spreads in your body. Okay. But if you were to have PrEP with, Truvada here, this is showing if you were to take Truvada, what happens is it creates a protective shield around your T cells. So when your body comes in contact with the HIV virus, they can't be penetrated by the HIV virus. And the HIV virus cannot multiply, which causes it to die off. Okay. So getting back into the types of HIV PrEP medication that we have, the next is going to be your long-acting injectables. And we have Apretude. So Apretude is an injection in the buttocks here. You would get it every 2 months, all right? And it takes about 7 days before you have full protection. With this medication, you can do pills before. People who may have like a high risk of having an allergy, we would normally try to get them to do the pill first before just injecting them because it is a long-acting medication. You know, we wouldn't want them to have an allergic reaction if they're more prone to them. But anyway, so Apretude, every 2 months, I have a lot of patients that they may have been on the pills that's moving to this. This is a way that, you're not having to take a pill every day and not having to worry about, hey, did I take the pill today? Forgetting about it because you know that you're protected because you already have the shot. All right. So this medication is deposited in the muscle, and what happens is it releases over time. And that's how you have protection with Apretude. The biggest complaint or side effect I hear with this medication is the injection site. It takes some getting used to. I have patients, they usually get used to the shot by about the third or fourth one. But before then, they usually kind of having a rough time with it because, again, this medicine is deposited in the muscle. So that could be hard for some people, especially those first couple of days. But again, people usually get used to it. But that is Apretude. That's one of the long-acting injectables. And then we have the newest long-acting injectable, which is the last medication I'm going to talk about. It's called Yes2Go. The other name is lenacapavir. And this is an every 6-month injectable. So this is a huge game changer for the field of HIV. It just got approved last year, September, August, or whatnot. But this is literally people are only having to get 2 shots a year, and you are protected against HIV. This is also a deposit shot. It goes into fat instead of going into the muscle, which people have had issues. I'm just talking about the Apretude. This goes into the fat, and people have some injection site issues with this as well. But I haven't heard too much complaints from patients about this yet. But again, it is still one of the newer meds, and 2 shots a year. Also, it is 99.9% effective. So it is superior to all of the other PrEP medications, to include the oral PrEP. This right here is the best in terms of protection for HIV. And in addition, you get your shot on day 1, and then day 2, you take 2 additional pills because you have to take, when you're starting this medication, you have to take 2 pills with it. By day 2, you have full protection against HIV. So that's a major game changer for a lot of folks. So Those are all the PrEP medications. And so you might be thinking, what PrEP option is best for me? Uh, given everything that I've talked about. So again, just to recap, we have the oral options, which is Truvada and Descovy. Okay. One pill a day is 99.4% effective. All right. And this is the best option for IV drug users. This is the highest protection for them. They have about like 74% protection with taking the oral options, better than zero. And then you have the injectable options here, Apretude and Yes to Go, which Apretude has a higher efficacy in terms of HIV prevention, 99.7% effective. And then you have Yes to Go, 99.9%. It outbeats all of the other. So again, which PrEP option is best for me? One thing you want to look at is medical issues. Do you have liver or kidney damage? Anyone I see that has any indication of this at all, I'm like, listen, let's look at the injectables. But again, it is the patient's decision, but we talk about that. Daily routine versus injection. Are you someone who's going to remember to take your medication? Or are you someone who is going to be worried because you missed a pill? Okay. Your comfort level with pills. I have people who do not like to take pills, and I have some people who are like, no, I know that it's in my system if I'm taking it this way. Access to appointments. So with the pills and with PrEP in general, you have to come in every 3 months. With the Apretude shot, you're having to come in every 2 months. With the Yes to Go, you're still having to come in every 3 months because you're getting STD checks, but you do not have to get that shot except for 2 times a year. So these are things that you have to consider when you're thinking about which medication may work best for you and personal preference just overall. I have some folks, they're like, I don't want to do that new shot. That's too new. Let me wait a year or two, see what's going on, and we'll talk about it later. Is PrEP safe? This is the biggest comment I get, especially from my Black females, because, as Black folks, we don't have a history of trusting the medical community. So, I mean, based off of history. So we question a lot of things. So PrEP, I want to let you know that it is well studied and very safe. Okay. The reason that you're coming in for appointments, if you were to get put on PrEP by a provider or HIV clinic like ours, you would be getting that routine monitoring. We're looking at your major organs every time you get labs. We're looking at kidney function, liver function. We look at that every time you get labs, which is at least every 2 to 3 months. Okay. I have folks that do not have a primary care provider, but they kind of use their PrEP visits as a way to keep a uh, information on what's going on with them because they know that they're getting those labs done. So you're going to get routine lab monitoring, and the medication can be stopped if there is an issue. Again, I've been doing this about 5 years, and I have not seen anyone directly have a side effect. And this is from doing the older medications, oral PrEP. I have people who've been on oral PrEP for years without any issues. And a lot of times, if it is found to be, usually with a medication, if it's found to be the issue, you remove it, you should be fine once it's removed. And this PrEP is also safe to take while pregnant or breastfeeding. Again, I have a lot of patients. I treat HIV positive patients, and their partners may be negative. If they want to conceive a child, it's best for the woman to be on PrEP in order to protect herself and the unborn child. So they would take PrEP if they're not already taking it. And they make sure they take it throughout the whole pregnancy, and they can take it afterwards. So it's safe, during breastfeeding as well. So I'm just going to address some myths that we hear about PrEP, which is one of the ones I hear a lot is it's hard on your kidneys or it's hard on your liver. It has some bad side effects. And again, PrEP is safe. Most people do not have side effects. Usually people have the side effects I talked about earlier, nausea, upset stomach, things like that, that go away after a week of taking it. Long-term use of PrEP can cause liver, kidney, or bone problems. These medicines may not be safe for people who have a liver or kidney disease. We have to tell you that because it is a potential, but again, I haven't seen anything like that. And it just has to, it's one of the things you have to be made aware of, but we rarely ever see that. Another myth is PrEP is expensive. In fact, many insurance plans cover PrEP, and there are multiple assistance programs that can help you either get it for free or low cost. The health department here in South Carolina, they have programs to help people with getting on PrEP. Also, a lot of these pharmaceutical companies, the ones who actually make the PrEP medication, they have programs in order to try to get people access to these medications. Next myth is only people with risque lifestyles need it. So we spoke about this even if you only have sex with one person, it's good to take PrEP if your partner is HIV positive with a detectable viral load. That's a way of protecting yourself. Okay. Or if you're not sure of your partner's HIV status. We have people who are in relationships and they're aware that their partner is, sleeping with other people, or they may have an open relationship, whatever. This is a way of protecting yourself. You know your partner is an IV drug user. That's a big one, because they are at increased risk of contracting HIV. You're having sex with that person, you are as well. And again, your partner has sex with other people, which I just stated. PrEP is only for gay men. So, yes, gay men make up a large population of HIV positive patients, but PrEP is for anyone who doesn't have HIV as listed before. Most of my females who are HIV positive, they got it from a partner. They weren't out here, messing with multiple people. It was with that one partner who they didn't know their status. Partner maybe didn't know their status, maybe did. That's always something that we don't know. Sometimes it kind of gets going back and forth. But PrEP is for anyone who doesn't have HIV but is at risk of getting it through sex. The CDC recommends PrEP if you've had anal or vaginal sex in the past 6 months. If you and your sexual partner have not used condoms every time, and then your partner is having multiple partners, your partner has HIV again, you were diagnosed with an STD in the past 6 months, or you're a woman with an HIV partner who is trying to get pregnant. So, touching on STDs, PrEP does not prevent gonorrhea, chlamydia, syphilis, herpes, trichomonas, or HPV. Okay. PrEP is specifically, HIV PrEP is specifically preventing HIV. Okay. And so if you were to get on PrEP in our clinic, most clinics that do HIV prevention, we're also going to be testing you for gonorrhea, chlamydia, syphilis, and trichomonas. So it's a way of kind of keeping up on your STD status, because we look at all those things, but we don't have medication specifically to help prevent that. And again, the South consistently has higher STD rates. We live in the South. This is prevalent in our community, which increases your risk. This is just touching on gonorrhea. African Americans account for 73% of the cases. This is data from South Carolina, actually. So South Carolina ranks high nationally for gonorrhea and syphilis. Chlamydia, 40%, African Americans in 2022 made up the chlamydia cases, while 20% were white. It is what it is. Black women experience higher STD rates compared to white women in South Carolina, unfortunately. And because we experience higher STD rates compared to white women, we are at a higher risk of contracting HIV, because the more at risk you are, or the more STDs you acquire, the higher your chances are of contracting HIV. Those conditions all increase inflammation. HIV is a virus that increases inflammation. If you're already in an inflamed state, it just makes it easier for you to contract HIV. That's just how it works. So STI testing matters. Getting tested is important, because again, STIs are primary risk factor for HIV infection. More STDs, increased risk for HIV. A lot of times women do not have symptoms. Can't tell you how many times something comes back positive, chlamydia, gonorrhea, whatever. They're like, nothing's going on down there. I didn't feel anything. I don't feel any kind of way. Women don't have symptoms all the time. Most women do have symptoms like discharge and things like that, but some people don't. So this is why, getting the testing is important. You can end up having infertility issues if you're not tested regularly, pregnancy complications, and pelvic inflammatory disease, it occurs when you have untreated STDs, which pretty much causes you to have, some damage to your uterus and your reproductive system. I wanted to cover this briefly, even though women can't technically take this, but DoxyPep, I prescribe this a lot, but this is pretty much the morning after pill to help prevent an STD. Okay. The STDs in particular will be syphilis, gonorrhea, and chlamydia. We have seen a really big improvement in the STD rates in our clinic with people taking this. So what happens is so a person has a sexual encounter that was condomless. So it can be oral, vaginal, anal sex. So within 24 hours, they take doxycycline. Doxycycline is an antibiotic. They would take 2 of those pills within 24 hours, preferably, but you have 72 hours to take those 2 pills, okay? But they would take those 2 pills, and it's been shown to decrease their chances of having syphilis, gonorrhea, and chlamydia. And I keep saying that because it's just those 3 STDs, okay? But this is here. Within 3 days, you take 2 pills for just 1 time, okay? And the only thing with this is it has not been shown to be that effective in females. So it is not recommended for females. And so we don't prescribe it for females. Hopefully we'll have more research with this, or they'll maybe look at a different type of antibiotic or different type of, medication or method that can help the females. But I just wanted to highlight this, and you guys know any males, because this particularly it works for males, in their chances of contracting an STD. Okay. And I did want to highlight post-exposure prophylaxis. So you had a contact with someone and you're worried about HIV. You're like, oh my gosh, that person could have had HIV or whatever. There is medication that you could take for that. You have 72 hours to get that medication in your system, okay? Post-exposure prophylaxis is taking anti-HIV drugs. Those anti-HIV drugs are actually the medication we use to treat HIV. So you would take the medication, HIV medication, for about 28 days. First, we would test you, and then we would prescribe the medication. You take it for 28 days. You come back in and you would have HIV testing again. And pretty much from what I've seen, a lot of people are negative. But this is a way to protect yourself after you have come in contact with someone that you were worried or you found out was HIV positive. You have 72 hours to get this medicine in your system. It is available in the ER. So anywhere you go, you should be able to get this in the ER. Or if there's a clinic like the clinic I work for, which is HIV clinic, you should be able to get in with them as well. PrEP appointments equate to prevention appointments. So just like I have stated, um, if you were to get on PrEP, not only are increasing your chances of not contracting HIV, but you're improving your overall sexual health. You will be tested every 2 to 3 months if you're on PrEP for syphilis, gonorrhea, chlamydia. I have tested trichomonas and herpes for some folks, even though it's not routine, but you are getting that test done every 2 to 3 months, okay? Um, you are coming in contact with a sexual health provider like myself, where you're able to get educated, you're able to discuss any concerns or questions you may have. A lot of people do not talk to their primary care doctors about their sexual life. I always say, like, you go to the doctor, it's just like they don't think about like you're a person that has sex. They're just like, well, nobody, they don't even ask you about it. So a lot of them don't know the risk that their patients are in until you actually start talking to someone, asking them about their sexual lifestyle and things like that. They're not aware. So usually, people that get on PrEP, they're able to come into our clinic and take their sexual health serious, and they're able to talk to us and feel free to talk to us about things that they may not talk to their primary care about. All right, so opportunity for open discussion, and it puts you in control of your sexual health for sure. So where can I get PrEP? The biggest thing I want you all to know about is preplocator.org. So you can go to this website here, anywhere in the world, and you will be able to find a PrEP provider. Okay. And then we have some online platforms. Q-Care is a big one. I have patients that use this platform, or they prefer in person, so they come in to see me. But Q-Care is a big one that folks use. And Healthy Sexual, it gives you kind of information about PrEP, which is really good, and can help you with finding a PrEP provider as well. And then, of course, I just listed Aid Upstate, which is the organization I work for, do HIV treatment and HIV PrEP and PEP. And the health department. The health department has an HIV PrEP unit, so you can get PrEP at the health department. And then we have some other organization here. PALS is in Columbia, and of course the CDC to get information. And that's all I have. I can talk about this all day, but that's all I have. This is my information again, lizadra.cade@icloud.com. If you guys have any questions that you may not want to ask on here, or just want to reach out to me, that's my information. But yes, so now we will take questions. If you do have any questions, I'm here. I will try my best to answer. Okay. But yeah, shoot them off.
Thank you so much for that presentation, Ms. Cade. I'm gonna assist. My name's Ariel Wesley. I'm one of the sisters of the Columbia chapter, so I'm gonna help moderate some of the questions from the chat. So the first question is from Ms. Gethers. Is HIV medication affordable for people without insurance?
HIV medication, or we talk about HIV PrEP? I guess I'll answer both. So there for HIV medication, patients who are actually HIV positive, there are programs in place by the federal government. You have Ryan White. They disperse money to all the states that help with covering medications for HIV positive individuals. And this is in an effort to help with decreasing HIV in the community. It's a public issue, a public health issue. So we do have programs in place that help patients with getting their medication. Um, if you're HIV positive, you're going to be able to get medication. That's just it's going to happen. Now, for HIV PrEP, we have a lot of programs that are in place as well that are helping individuals get PrEP. One, if you are insured, a lot of insurance companies do cover PrEP. They may not cover the injectable, but they at least will cover the pills. The pills have been around for the longest, like I said earlier. But if they cover something, I've ran into that they do. And if they don't, we have the pharmaceutical companies have programs in addition to the state. I was just talking about the health department. They have a whole PrEP program within the health department that helps with individuals getting on PrEP. So there are resources out there. I've never had a patient come to me that we weren't able to get PrEP medication.
I'm not seeing any questions in the chat right this moment, but I have a question. What do you think has happened that changes the perspective regarding prophylaxis? Because I remember 5, 10 years ago, people were like, I'm not using PrEP, I'm not using PEP. That means I'm out here in these streets, so to speak. But um,
Yeah.
the perspective has changed to it being like, hey, that's part of my healthcare. So what do you think has contributed towards that?
I think people are more educated on it now. That was a really, you still have some folks that say that. Like the biggest thing with PrEP I used to hear was, oh, that's just giving you license to be a hoe. Like people would say stuff like that. And it's just like, no, it's protecting you in case you were to come in contact with HIV. You don't have to be having sex with multiple people to come in contact with HIV. And I think people are just more educated on it now and they're just more aware like, okay, hey, this is a medicine that can help protect me. So I think that's part of it. I think that's the biggest part of it really is just people being more informed. And the newer generation, the younger generation, they're more proactive about learning about things like this. And, at least that's been my experience with working in this field. They're when they come into me, they have questions, but they've already been online. We have a lot of online platforms, things that didn't we have information at our fingertips all the time. So you can look something up versus, having to go to a library or talk to a specialist. You have information online, you have where you can access the medicine online too. A lot of people like that because it's private and then you can get the medicine sent to your house. Not anyone would know that you're on it. So we just have many different avenues where you're able to get the medication, where you're able to learn more about it. Um, that's my experience.
Okay. Sister Pitts asks, is there an restriction for HIV PrEP medications?
Their age restriction. As far as I know, believe you would have to be at least like 12 and up, like teenage age to in order to get it. I'm not exactly sure on that. I treat adults, but that, of course, the parent would have to be involved with that. Um, and from my understanding, you can, like, teenagers can take it.
Okay, thank you. And does anyone else have any other questions? Not seeing anything else in the chat. Bear with me a moment. Just gonna give them a couple more seconds. And then there will be the evaluation portion of this. So of course, um, there's going to be a QR code that presents on your screen. If you could just scan that code. So again, thank you.
So while everyone is finishing up the evaluation, I just want to again say we appreciate all of you for joining us today, and we appreciate our speaker for the wonderful job she did and the very informative details that she provided to us. Thank you very much again. I wanted to draw your attention to some of the upcoming events that we have. If you take a look, these events are available. You can register on Carolina Box Office and or Eventbrite. If you go to either one of those platforms, you should be able to register for our Women's History Month celebration that we are having. Actually, we are partnering with the American Business Women's Association for the fourth annual ABBA Day at the State House. We also have, given by our health committee, another event, Dementia 101 with Tori Anderson. So please register and join us. I think these are going to be two amazing events. We also have coming up our rescheduled membership interest meetings. One is for Sunday, March 15th, pardon me, in person, 3 o'clock p.m. at Brooklyn Baptist Church. And the second one is virtual, and that is on Tuesday, March 17th. Again, both should be available on Eventbrite and on Carolina Box Office. So please register and attend. We would love to see you at all of our events. And then again, we have saved a date for our 2026 Sheroes Scholarship and Awards Luncheon. And that will be Saturday, April 25th, again at Brooklyn Baptist Conference Center. Tickets will be available shortly, but please save the date on your calendars. It's going to be an amazing event where we celebrate our young scholars as well as amazing women in the community. And please do follow us on social media. You can also find our events on Carolina Box Office and Eventbrite, and we're on YouTube, LinkedIn, Facebook, and Instagram. And you can also visit our website. Okay. So if we don't have any other questions, I would like for our president, Madam President, to have our closing remarks.
Good evening, everyone. I would like to say thank you for all attending this very informative webinar on HIV, PrEP, and the real world care about it, because it takes should I say, a dedicated person such as the speaker who brought this before us to put out all the awareness for us to know about this. And I actually learned some things while listening myself. And again, you're never too old to receive information. But again, on behalf of the National Coalition of Black Women of 100, we would like to say thank you. And to our health committee, thank you again for orchestrating this wonderful webinar. And again, knowledge is power. Thank you. Cheryl.
Yeah.
Someone just put in the chat and they asked, would this training be available again?
Um, let's see. It should be available via recording on YouTube. I know that's what we usually do.
Okay, great.
Mhm.
And also, Miss Cade, we look forward to seeing you at one of our many events that we have. So if we can be an assistance to you in Anderson, just let us know. And again, thank
Okay.
you for coming out tonight to
Thank you for
educate
having
us
me
on
again.
this. Yes, thank you.
Okay. Good night, everyone.
Good night.
Good night. Take care.